Well, I grew up working on the farms when I was real young. Then I was a landscape contractor since I was 15. I've always had a problem with my shoulders, and it was at the point that I couldn't reach into the cabinets and grab plates out. I couldn't reach above my chin level.
Patients who come in with shoulder arthritis usually are complaining of multiple things. One is pain, and especially pain at night, pain with activities, and the other one is loss of mobility. In the early stages of arthritis, some physical therapy can be of some help to help with strengthening of the muscles around the shoulder. If that doesn't work, we could always consider something a little bit more invasive, like a cortisone injection. If all of that fails, then we talk about more aggressive surgical treatment, which is something like replacing the shoulder completely.
I just kind of always fought through it and figured it was a pain I'd never be able to get rid of. After meeting with Dr. Gebies, it was amazing to what he thought he could do.
Mr. Dubree was unique in that he had very limited function and quite a bit of pain in both of his shoulders, and he really couldn't do anything for himself. When I examined him, he had severe arthritis of his left shoulder, which was basically bone on bone, and he had very limited mobility. On the right side, he had a very similar problem as well.
And he did my left shoulder, and the relief of being able to sleep at night and not being able to have that problem in that side, it was just amazing.
This is what Mr. Dubree's shoulder looks like after it's been replaced. You can see this is the stem that's sitting inside the bone, and this is the hemisphere piece, which makes a new surface for the ball. If you look closely here, you can see a little metallic marker, and what that is, it's a little piece of metal inside the socket, which represents the area where the socket has been placed. Now, the socket's made of plastic, and because it doesn't have any calcium in it, you can't really see it on an x-ray. If you look closely, though, you can see that where there used to not be a gap, now there's a gap, which represents his new joint, which means that he's no longer bone-on-bone arthritis. Once he had sufficiently recovered from his left shoulder and he started to get some function, we felt that it was safe enough to proceed with the right shoulder.
I couldn't even get a plate out. Now I can reach up in the cabinet and get plates. I can do things that I love to do.
As a physician, there's nothing more gratifying than having a patient come back and tell you that they're able to do things just a few weeks after an operation that they hadn't been able to do for several years prior to you doing this type of intervention on them. He was able to lift his arms up overhead, he was able to reach away from his body, he was able to reach up into a cupboard, and he was able to do these things without pain.
I'm so grateful. Just to know there's a Loyola, it's amazing.